that area of the world. And so Sri Lanka is part of the United Kingdom, British Commonwealth. So there's a big British influence there, and Dr. DeSilva grew up there, went to British schools when he was younger. Their native language their native tongue was English. That's what his parents spoke in. And at the family home, that they had another language that I guess is similar to Indian.
To Sanskrit.
Sanskrit. Whatever that is, I've heard of it, but I'm not sure. Does anybody speak that language? Where is it?
I don't think anybody speaks
It's
that.
a dialect that comes out of China.
So his father, he had one brother, no sister?
I have one brother and one sister.
Yeah, and so his father said, these kids got to get a good education, so I'm going to move to the United States, and he did. He brought the family there, and they settled in the Philadelphia area, and they grew up Catholic. Interesting, because the Portuguese, DeSilva is a Portuguese name. So they came over here and grew up and went to Catholic grade schools and to Franciscan high school and then college, and then went to medical school there in Philadelphia and became an internist. Dr. DeSilva, since he has graduated from med school, has always been very interested in natural approaches to health. So he's on staff, and are you chief of staff right now in that hospital?
I am the assistant director of the Integrative Medicine program.
Of the greater?
Integrative Medicine program.
Okay. So he's been integrative medicine is what it's called in some circles, where you do a little bit of the conventional and you do a lot of the natural or vice versa. But mostly guys in integrative medicine would be very similar to us. Functional medicine, holistic medicine, we call it natural approaches to health. So he's been a leader in that movement for 30 years. He has his own supplement company. He's designed over 100 different products. And I met Dr. DeSilva. It was in 2 years ago in Las Vegas, and I heard him speak about glycocalyx. How many people here have ever heard the term glycocalyx? No, one, two. Well, glycocalyx is the hairs that line our arteries. We have little hairs that line the arteries, and when they get inflamed or infected, they die off, and that's what happens when you get coronary artery disease from the inflammation. So he devised a product called arterisol that helps stimulate reproduction of the glycocalyx and healing of it. There's certain measurements you can think about how the glycocalyx is to know how severe heart disease you have. We're not doing that right now, and when I went to that conference, I heard him speak on arterisol. I came back and I watched the videos, and I was so impressed by his speaking ability. But while I was there at that conference, I caught him in the hallway, and I can't remember who was with me. Were you there? Somebody was there, and I got a picture with Dr. DeSilva. And I sent him a letter, and I sent him a framed photo. And didn't hear, I don't think I heard a thing back from him until about a year later. He called up and said, I'm coming to Houston. I'd like to come by and meet you. Dr. DeSilva. Oh my gosh, that's really great. So we set up a time, and it turned out we couldn't meet. And he subsequently called back and talked to me about what he was doing, and told me that at this time that he had devised a product that uses cannabinoid oils, hemp oils. You hear it's called CBD oil. Really can't be called that on our labels because there's a drug product that the FDA has approved by a pharmaceutical company called CBD, so that name can't be used. Some big companies have been knocked by the FDA. So all these people that have CBD oil, it's really not legal for them to use that name because it belongs to a pharmaceutical product. So what Dr. DeSilva did was change the name, make it hemp oil. So the oil that he designed comes from a hemp plant, and he's going to tell you why it's a superior product to all the other products that are on the market. When he told me he was interested in cannabinoid oils, I perked up. For 3 years, I've heard about it. I'm sure you've been in contact with patients. People have said, well, does Dr. Hotze sell CBD oil? Has anybody been asked that? Any of the nurses, everybody asked it? Down in the pharmacy, what does Dr. Hotze think about CBD oil? I'll have people come by here. They've tried to contact me. They want us to sell the CBD, their brand. Some man and woman, some couple go, well, we'll sell CBD oil, and I don't know where they get it. They bottle it and they sell it. But I've always said, I'm just going to keep hands off. We've got enough that we're doing. But when Dr. DeSilva said, this product is a great product, I have devised it. It's liposomal, which means it's wrapped in a lipid ring, and it's easily absorbable. It's water soluble. It all doesn't dissolve in water, but when it's in a liposomal form, it does. It means it gets in the cells quickly. And he'll talk to you about it. So I've read articles about CB, and it's not THC, which is what's in marijuana, the drug that gives you some kind of high. So it's not that, it's the oils, and it's a full spectrum oil. So he designed this, and I said, that's interesting. If you do that, and you've had success with your patients, I'm willing to do that. And so I had James call him, and we private labeled our product, and we carried it. We opened it up last night. And we're using Dr. DeSilva's product because I know, like, and trust Dr. DeSilva. I wouldn't have done this for anybody else, but I've seen Dr. DeSilva, and he's such a wonderful and gifted speaker who knows his medical issues, especially about natural approaches to health. Because if he does it, then we're going to at least try it with our guests and see how they do. It's either going to, you all have heard that it cures everything from baldness to ingrown toenails and everything in between. So all new products like that are panaceas for every ill that ever afflicted the human race. I'm sure it kills malaria and the whole 9 yards. So, but that's the way the promoters talk about it. But it does have some definite positive and beneficial effects on the human system. So, Dr. DeSilva, who is internist out of New Jersey, speaks all over the world, travels 150, 160,000 miles a year, gone at least 100 days a year, speaking all over the world on integrative medicine and on natural approaches to health. I said, why don't you come in and come to our Bubbly Bows, speak to our staff and spend the day with us and educate us about that. So today, Don was only going to speak this morning, but I want to have a nursing and provider meeting at somewhere for 30 minutes or an hour between 12 and 2, so he can speak to the nurses and providers in more detail than he'll speak this morning. But he's going to give us a good overview of cannabinoid oils. So Dr. DeSilva, welcome to Houston.
Thank you. Thank you, sir. Thank you. Well, good morning, everybody.
Good morning.
Thank you for the invitation. It's always nice to be in a place where it's warmer than New Jersey. I was about 2 hours delayed yesterday because of the weather, but let's get right to it. And how much time do I have? 30 minutes? Okay, perfect. So let's get through this. For me, and again, I'm preaching to the choir here. And by the way, I'm doing this presentation at Grand Rounds at my hospital in New Jersey on Tuesday. So the nurses, the doctors, they're all asking about it, but same presentation I'm doing today. It's all about wellness. As you know, people want hormones. Great. They go home and they eat bonbons and yo-yos, and they come back and say, but I gained 10 pounds. I thought my hormones I'm supposed to lose weight. It doesn't work that way. This is my program. Conscious eating, I do intermittent fasting. Hormones are critical. Vitamins, nutrients, and supplements are obviously extremely important. And then movement. You have to do something. You really need to just be active and do something. Do something you love to do. For me, it's playing tennis. And I already have my weekend lined up with tennis when I get back, because that's what I like to do. It's 2 hours of a very nice, intense workout. Find what you like to do and do it. And last but not least, you have to be a good person. One good deed a day. Boost your immune system by 40%. Every time you do a good deed, you boost your immune system by 40%. So if I hold the door for you, your immune system gets boosted by 40%. My immune system gets boosted by 40%. But the beauty of this is that every single person that witnesses that good deed, their immune system gets boosted by 40%. That data comes from Harvard University. The doctor's name is Dr. Herbert Benson. The conference that he runs is Spirituality and Healing. It's an amazing conference where they talk about the connection between your health and your spirituality every single year. It's incredible. So let's get into the CBD. This is not something that popped up 2 years ago. at a gas station, all right? This is something that has been around for 12,000 years. The father of traditional Chinese medicine started using CBD or hemp 6,000 years ago. It was the first botanical that was used in traditional Chinese medicine. But here's the important piece right here. What is the difference between CBD and THC? This is where all of the confusion lies. This is where the confusion lies with physicians. This is where the confusion lies with legislators, and this is where the confusion lies with consumers. Everybody thinks that if you use CBD, you're going to get high. It is absolutely, unequivocally not true. Hemp or full spectrum hemp oil has no psychoactive effect, whereas THC obviously does have a psychoactive effect. It comes, believe it or not, from the same plant, the cannabis sativa plant. But the way the plant is grown, the way it's harvested, when it's harvested, all has to do with the concentration of CBD and THC. And when you receive, because you just got the bottles because you wanted to have it for the event here, James said make sure we have it. The boxes are going to have on our product a QR code that you can scan, and it will take you to the certificate of analysis. So you can see exactly what is in there. How much THC is in there? How much CBD is in there? How much CBG is in there? How much CBA is in there? So it is going to take you to our certificate of analysis where you look at heavy metals, toxins, et cetera, et cetera. It's all there. So the box will have that with your next order. So what is the endocannabinoid system? The endocannabinoid system, if anybody says to you, what does it do? What does hemp or what does CBD do? Your answer is that it balances the body. Very simple. It puts your body into homeostasis. That's the answer. You don't need to get any more involved than that at all. It is the largest neurotransmitter system in the body, and if it is present in all vertebrates, your dog, your cat, your horses, anything that has a backbone has an endocannabinoid system.
Why did it have that? Do you make your own endocannabinoids?
Yes. So we don't have plant compounds in our body, but we do have, our body makes cannabinoids. Those endogenous cannabinoids, which our body makes naturally, are called anandamide and 2-AG, and I'll get into that in just a moment. But these compounds, anandamide and 2-AG, work on the endocannabinoid receptors in our body. And again, a little bit more detail in just a bit. So here's what the endocannabinoid system consists of. And by the way, we all have it. Breast milk, human breast milk, has the greatest concentration of endocannabinoids, anandamide and 2-AG. And it just gets the whole system of the baby going. It is an amazing, as we all know, human breast milk is just unbelievable. It is the most amazing nutrition that your body can take. But anyway, endocannabinoid receptors, CB1 and CB2 receptors, these are the receptors that are in our body, and I'll talk to you about where they are in just a bit. This is what our body produces, anandamide and 2-AG, and these are where the receptors work. And then there are enzymes that our body produces that break the anandamide and 2-AG down. And that's what we have to do, is we have to keep these enzymes in check. And they are FAH and MAGL. Those are the enzymes. These are the bad guys, and these are the good guys. So we want more good guys, and we want less bad guys. So where are these receptors found? The CB1 receptors are mainly brain and spinal cord. So that's where they work, and the CB2 receptors are mostly within the immune system. So immune function here, this is why I can use this for colds and flus and also use it for brain injury. Because these receptors are everywhere everywhere in the body. There's no exception to that. So CB1 receptors, brain, spinal cord, connective tissue, reproductive organs, again, a little bit more detail later. CB2 receptors, spleen, and you can see these are all immune function organs, if you will. We've now looked at some new receptors called the GPR receptors and other orphan receptors, and those receptors are what we're focusing on today to treat certain diseases, like Parkinson's disease, Alzheimer's disease. These are other receptors that have been found that we know that work in the body also. So targeting therapies for these diseases are targeting these GPR receptors. So what about anandamide and 2-AG? Remember, what's an anandamide and 2-AG?
Endocannabinoids.
It's what our body produces, right? They're the endocannabinoids within your body. It's what your body makes. But at some point, your body, when you get into your 50s, 60s, 60s and 70s, the body doesn't do what it's supposed to do. So it needs a little bit of help. But it's not only then, it's even in childhood. So these receptors and this, your body's ability to make anandamide and 2-AG is critical, is absolutely critical. So what about anandamide? Anandamide was looked at in the 1990s. It comes from the Sanskrit word, which means bliss. Now, in the language, one of the languages that I speak, it's called Sinhalese. The word for happiness or bliss is ananda. And that's where the word anandamide, believe it or not, comes from. It's got a very short half-life. It is much more active in the CB1 receptors, not as much in the CB2 receptors. So tell me, where does anandamide, bless you, work?
Brain.
The brain and the spinal cord. All right, so PTSD, OCD, Parkinson's disease, multiple sclerosis, et cetera, et cetera, et cetera. Any kind of a neurologic issue. Some of the functions: sensation of pleasure, happiness, euphoria, ability to cope with stress. I don't think anybody has any stress, so don't worry about that. Just ignore that. Relieves anxiety. My top 3 uses for full spectrum hemp oil is number 1, inflammation, number 2, inflammation and pain, number 2, anxiety, and number 3, sleep. I'm telling you, you will sleep. I'm telling you, you will sleep. For those of you that are taking hormones and you're on a little bit of progesterone, use the progesterone like you're supposed to around dinner time and take this baby right before you go to sleep, about 30 minutes, you will sleep. The most awesome dreams, why? Deeper sleep. You're getting into deeper levels of REM sleep. When do you imprint memory? Why is it so bad to cram for an exam and pull an all-nighter? I never did this in college and medical school. Never did an all-nighter. Why?
Because you deplete anandamide.
Well, you deplete anandamide, but your brain doesn't imprint if you don't sleep. So you're up all night, all day studying, but in order to remember for the exam, you have to sleep. So that what you learned has to be imprinted into your brain. So, and I knew this when I was in school, so I never did that. I always made sure I planned my day, I studied, and go to sleep whenever you need to go to sleep, but you have to sleep in order to imprint what you've learned. This is one of the other reasons where sleep is so critical. Causes relaxation. And the deficiency is linked to increased levels of stress. By the way, almost all of these slides have references, so I'm not making this stuff up, okay? This is for real. It's necessary for learning, transferring short-term to long-term memory, and it allows you to forget some things also. There are things in your memory that you just don't want to remember, and you know that. If you've been through a traumatic event, you don't want to remember that. So anandamide allows you to also forget. Anandamide is important for energy, for appetite. I have a lot of weight loss clinics. In fact, in Puerto Rico, we do a lot of business in Puerto Rico. ¿Alguien aquí habla español? ¿Quién? Muy bien. Yeah, I mean, I do a lot of business in Puerto Rico. In fact, we're going to Puerto Rico the last week in December, in January, because we're doing a huge seminar there. A lot of the practices down there have weight loss practices. And one of the things we use in weight loss, because it controls the appetite, anything that THC does, and remember this way, anything that THC does, anything that marijuana does, full spectrum hemp oil just does the exact opposite. It's the yin and the yang. THC makes you high. CBD does not. THC makes you eat, right? You get the munchies. CBD does not. THC relaxes you to a degree, and then you become paranoid. CBD does not. So it's the yin and the yang. It's the way this is made. This is the way God created this. It's amazing. You come into the emergency room and you're high, and you don't die from an overdose of THC, but you can come in very paranoid and very high. What do we use, and this is what we're using in our hospital right now in the emergency room, for people that come in that are high on THC? CBD. Why? Because it blocks those receptors and it displaces THC. Exactly. So this is an absolutely amazing compound, and that's why when I talked to Dr. Hotze, I said, look, you have to do this. I mean, this is the most incredible botanical. I've been seeing patients for 31 years. This is my 31st year in clinical practice as an internal medicine, as an internist. I've developed well over 400 products. I have never in 30 years seen a product with so many applications. Never. This is one of the most amazing things that I've ever seen. And look at this. Anandamide. You need this in order to implant the embryo. You need appropriate levels of anandamide to implant an embryo. It's used in some people, in some women, in the treatment of infertility. Now, do I recommend this during pregnancy? No. I don't, because we don't have an indication. So my answer is no. It enhances libido. It is released during ovulation. What about 2AG? 200 more times 2AG in the body? It is a full agonist for both CB1 and CB2.
So what an agonist means?
It means that it enhances those receptors. It makes those receptors work versus an antagonist, which blocks receptors. So it enhances the CB1 and the CB2 receptors. But the main effect is in the area of the CB2 receptors. So where does anandamide work? Brain, spinal cord, CB1.
Right.
Where does CB2 receptors work?
Immune system.
Immune system. Now, there's a little bit of crossover between the two. They're not pure. There's a little bit of a crossover, but the main effect, the main action on 2AG are the CB2 receptors. This is why I said you can use it for cold and flu, or you can use it for pain. You see now why. Because these receptors are all over the body. There are receptors that we haven't even found yet. A couple of my PhDs in Florida, we were talking about this one day. We were all out and just having dinner, and we started talking about this. And they said, we haven't even scratched the surface. We haven't, because God is really smart, and we haven't even gotten close to what I think that this compound is going to do. Some of the other functions, regulates immune function. This is where the anti-inflammatory component comes in. This is where the pain relief comes in. And by the way, this compound has COX activity and has LOX activity. What does that mean? Cyclooxygenase or the COX effect is, where do you get that from? Motrin, Advil, Nuprin. But it also has a lipooxygenase effect. What that means is that it not only relieves pain, but it relieves inflammation. Because if I'm relieving your pain, Susan, and the inflammation continues, the joint continues to be destroyed. Or if I'm just relieving the inflammation and you can't deal with the pain, it doesn't work either. There's two other botanicals that do that. One, turmeric, and number two, there's an oil that comes from New Zealand, that comes from a green lip mussel, that has that has COX effect, a COX-2 effect, and a lipooxygenase effect. So there are three compounds that have that activity, and that is very rare, quite honestly, in nature. So it's also released when tissues are injured. What does that mean? What that means is, if you are involved in a traumatic, let's say you're in a motor vehicle accident, or you fall, or you hit your head, traumatic brain injuries, and 2-AG is released. This is where full spectrum hemp oil comes in to replete or to put back what your body's going through, if you will. My younger son was involved in a T-bone in a car, very serious car accident. Thank God he walked away from that thing, and he was fine. First thing I said to him was, go home and take some of the full spectrum hemp oil, because I know a lot of 2-AG was released, and you need to put that back. No neck pain, no headache, nothing. And it's because of that. If any of you have children that are playing football, give them a little bit before the game, give them a little bit after the game, because there's always that repeated, trauma that they're going to have. 2-AG functions, once again, reducing seizures, regulates the vascular system, helps relieve blood pressure, and also has what is called a paracrine effect in the gut. What that means is that the body's cells, bless you, nervous system cells talk to nervous system cells. Every single system's cells talk to each other. But within the gut, the paracrine effect is that nervous system cells will talk to digestive cells. That's the paracrine effect, is that there's a crossover. And where does that happen? In the gut. And what happens here, that's why the gut is called the second brain, right? It's been called the second brain. That's why. It's called the second brain because it doesn't have nervous tissue, but it acts like a nervous system organ. Where's the greatest amount of serotonin and all of the other neurotransmitters made?
Good.
Made in the gut. Why? Because the gut is called the second brain. Why? It's because of this paracrine effect. And what does CBD do? It enhances that effect. It enhances that talking effect within the body. So, are you getting a sense of what this really is? And I'm not making this stuff up. Again, I have references here. This is all researched. This is all very well looked at. Dr. Ethan Russo calls fibromyalgia, irritable bowel syndrome, intractable seizures, and resistant migraine headaches and irritable bowel, he calls this an endocannabinoid deficiency. So if you've got fibromyalgia, you've got migraine headaches, you've got IBS, you have an endocannabinoid deficiency. You're not making enough anandamide and 2-AG. Now, this gentleman is a neurologist from UCLA. So this is published data. This was published in Neurology, the journal Neurology, probably about 5 or 6 years ago. This is how FAH works. This is the enzyme, once again, that breaks this down. What does CBD do? It blocks that enzyme, and it doesn't allow that FAH to go. So what are the clinical applications of how do we use this in our practice? What did I say before? What are my 3 primary applications? Pain, inflammation, anxiety, and sleep. Those are my 3 primary applications. So pain, number 1, anxiety, number 1, and sleep, number 1. Appetite has an effect on appetite. Movement disorders. movement disorders, Parkinson's disease, benign essential tremor. Any kind of movement disorder has to do with the CB1 receptors and anandamide, and this is incredible. I have patients that have Parkinson's disease. After I get all the heavy metals and all the garbage out of their system and get them off all of their ridiculous drugs that don't work, what I do is I put them on testosterone and I put them on full spectrum hemp oil. And it works. I can't even tell you, the gentleman came in, he was just barely 50. Testosterone level was really low. Walking, came in with a cane, came in with a walker. After I put him on some testosterone and gave him the full spectrum hemp oil, he started walking with his cane. And he carries his cane now. I mean, he's not running, but he's walking a little bit better. He doesn't have, that shuffling gait that the Parkinsonian people have. So there is an absolute application there. Memory. Why? Why memory? It helps you sleep. Remember, it imprints memory. Seizures. There are two drugs that have been approved by the FDA called Epidiolex and Sativex. Nobody should be calling this CBD. Get those letters out of your lingo. What you should be saying here and outside is full spectrum hemp oil. CBD is a drug. You're not selling or talking about CBD here. You're talking about full spectrum hemp oil. Because in order to get CBD, you need a prescription. What we have here is full spectrum hemp oil. Epidiolex has been used for children with intractable seizures. This is FDA approved, and Sativex is used for women, or used for people that have neurologic damage from multiple sclerosis. That's Sativex. So those are the two drugs that have been approved. Now, the pain industry is going to lose $83 billion in the next 3 years. $83 billion in the next 3 years. That's just the pain industry. What about the sleep industry? What about the anxiety industry? What about the depression industry? Do you know how much money they're going to lose? Why do you think the FDA and all the drug companies are freaking out? It's because of that. They're going to lose billions and billions, and it's going to hit the trillions. There's no question. We know that. Just one category, $83 billion. This is why they're freaking out. And you know what? It works. Anything that works is no good if it comes from a plant. There's no studies, there's no data, it's no good. Seriously? There's so much data. There's so many studies. My mother always told me, don't ever curse. But read the studies, for goodness sakes. Take the time and at least read this stuff, because it's for real. It is absolutely for real. Brain injury, autism. New Jersey has the highest incidence of autism in the country. One in every 35 boys has autism or some kind of spectrum. It's frightening. It's frightening. I'm treating quite a few children right now with, I don't see children, but young adults with autism. And folks, let me tell you something. What I'm seeing with these children and these young adults is unbelievable. I have one young girl who's actually verbal right now. I mean, people say, well, where are the studies? I don't care. You ask the parents, where are the studies? They don't care. My baby is doing better. What do I care what the studies are showing? That's all I want. So, and by the way, there are studies. You just have to read them. And there's plenty of them out there. So, seizures, brain injury, autism, movement disorders, etc. CBD and cardiovascular disease, it's wonderful for blood. It's not going to replace your blood pressure medicine. It's not, but it will help. What about breast cancer? They're targeting therapies right now, targeting something called the ID1 gene. That may be some kind of a treatment offer for people women with breast cancer. Brain health, again, we went through this. And these are some of the other things that the full spectrum hemp oil does. Antiemetic, it's with nausea and vomiting, anticonvulsant, antipsychotropic. We talked about COX-2, LOX5. And what else does it do? These are the receptors that it works on for pain, for sleep, and for your mood. So you can take this many times a day. But wait a minute. I'm using this to go to sleep. You have trouble sleeping, you're taking it for sleep, but you have anxiety and I know you probably don't, but have anxiety in the morning. Why doesn't it put her to sleep? You're taking it for sleep at night, but why doesn't she fall asleep in the morning? Because you're taking it for anxiety in the morning. Why?
Balance.
It balances the body, exactly. It puts the body in homeostasis. So in the morning, you don't sleep. We're not supposed to, okay? But at night, you go to sleep. It's controlled by your circadian rhythms, your circadian patterns, and cortisol. Cortisol is high in the morning, low in the evening. It's homeostasis. It has adaptogenic properties. What are adaptogens? Adaptogens are soft-acting plants, the botanicals, that have three properties. Number one, normalizes body function